Hi everyone, I'm Dr. Andrea Cermelli and I'm one of the veterinarians on Best Friends National Shelter Medicine team. Today I'll be presenting for you Whisk Away Ringworm, a concise navigation of successful diagnosis and treatment in the shelter. Ringworm is a fungal infection that can affect both animals and humans. The term zoonotic means that an infectious disease can be transmitted between species, so it's important to note that in the case of ringworm, it can be transferred from animals to people or vice versa. We want to be able to recognize the classic clinical presentation of ringworm in animals. This includes circular patches of hair loss, redness, and scaling or crusting of the skin. We often see it on extremities, like we see here in this lower left-hand picture of the cat paw. We can see it on the nose or the muzzle, like we see right around the nose area of this dog and the muzzle area of this cat. And sometimes we can see it in or around the ear pinna. Occasionally animals are itchy and exhibit itchy behavior and discomfort, but that's not always the case. And ringworm can present in many other ways. So lesions can be any shape or size. There can be varying degrees of inflammation and varying degrees of crusting or scaling. So it's important to realize that lesions represent suspicion only, but we can't diagnose ringworm based on visualizing lesions alone. And we'll get back to that idea in the next couple of slides. So how does this fungus spread? Well, first we have to talk about the exposure. The exposure can happen through direct contact or indirect contact. So direct contact is contact such as an infected cat rubbing up against a non-infected cat in the shelter scenario. It could be a person who does not have ringworm that is petting a dog that does. And it can also be indirect on fomites, and as you can see here, fomites are objects or materials which are likely to carry infection, such as your clothing, medical tools, bedding, or exam tables. And also you can have exposure through the environment. So if there are affected hairs from an infected cat or dog, and they're in the environment, and an animal or a human comes in contact with them, that could also spread ringworm infection. But just being exposed does not instantly mean infection. So a spore must reach the skin and invade defenses in order to establish an infection. So let's talk about cats. If we have a good groomer, a cat that's really good at grooming, they can remove the fungus. So it's less likely, but not impossible in healthy grooming cats with normal skin issues, but it can still be a problem. And why is that? Because sometimes those cats or those dogs will also have trauma or microtrauma to their skin. It's common that we see things like parasites, fleas, and ticks in animals that come into the shelter. And high humidity alone can cause maceration of the skin, which can allow for invasion of spores. And so in essence, the shelter provides the perfect storm. Shelter animals are stressed, and stress causes immune suppression. And they may not be grooming, or they may be grooming poorly. They could have concurrent parasitism that we see commonly in the shelters, like fleas or ticks. Shelters can be overcrowded, providing a source of contamination, and there's potentially poor ventilation, and poor ventilation leads to humid conditions. So ringworm is not an uncommon thing to see in the shelter setting. All right, we know what ringworm can look like, and we know that it's a risk in the shelter environment. So now let's discuss how we diagnose it. We want to utilize diagnostic methods to identify the problem and then follow up with fungal cultures for accurate identification of the ringworm species. The first diagnostic we use is the Woods lamp, and you can see that here on the left-hand side. The Woods lamp is used to look for fluorescence of hairs in the hair shaft in a dark room. And in the middle, you can see the depiction of that. So these hairs are fluorescing under Woods lamp examination in this cat. M. canis is the most common cat culprit and will fluoresce 90% of the time. Now we can also use trichograms for suspect lesions, whether they fluoresce or not. And a trichogram is just a fancy name for plucking and evaluating suspect hairs under the microscope. We can see the tools that we use for that in this lower middle picture right here. And finally, we have fungal cultures that provide a more precise diagnosis. You can see these fungal cultures on the right-hand side. They are incubating in the incubator, getting ready for us to evaluate them daily. The biggest takeaway here is that we have to follow up with a culture for suspects Because Wood's lamp and trichogram evaluation are never 100% effective. They do provide an index of suspicion, but negatives do not mean that ringworm is not present. And also, we'd like to know what species we're dealing with. And lastly, cultures are a really nice way to follow up on successful treatment. So though we can successfully treat without them if culturing isn't possible, culturing is really ideal. This brings us to trichograms and cultures. So I want to direct your attention to the picture over here on the left-hand side. You can see this white hair right here. This is a normal hair shaft. This black hair here is an abnormal hair shaft. And what I want to direct your attention to are specifically these little white circles that are present on the outer surface of that hair shaft. Those are actual fungal spores. And when we see those on an examination of a trichogram, we need to make sure to always back up our results by doing a fungal culture. So a fungal culture is as close as we get to a snap test for ringworm. And snap tests are point-of-care tests that come in kits and test for things like heartworm disease or feline leukemia and feline immunodeficiency virus. And though we don't have an actual snap test for ringworm, if we culture and identify the species on a culture medium, it's just as reliable as if we had a snap test that turned positive. So what you can see here is this picture of this kitty. This is our ringworm suspect. And we have a toothbrush here that allows us as a tool to brush this cat and the possible infected hairs from nose to toes and nose to tail. And then we focus in on the lesions that we found that made us suspicious in the first place, and we will brush those areas as well, and then plate those hairs in a circular fashion or a spiral fashion like you see over here on the right-hand side, and allow that culture medium to sit and incubate so that we can check for potential ringworm disease. Now, while we're waiting our diagnostic results, it's important to implement effective isolation measures to prevent the spread of ringworm within the shelter. And we want to use separate enclosures like you see here on the left-hand side. We want to use separate grooming tools for affected animals to minimize contagion. And signs are also very, very important so that public and volunteers are not walking into these rooms. And it's a nice reminder for staff that are allowed in these rooms for cleaning purposes and feeding to wear their personal protective equipment. So that brings us back to our cultures. Now from left to right, let's discuss what we see. On the far left, right here, we see an orange medium that is the same color as the color that we plated with. And so this is a negative culture. Now if we move over to these two mediums here, we can see that the color has changed to red, which is the first signal that something significant is happening and we need to take a closer look. The picture on the right is a closer up of what that positive culture looks like. So notice that the medium here is orange, but the medium in the middle where we have those affected hairs is starting to turn that red color. But it's really important for us to take an even closer look. So let's zoom in, take a closer look here. Can you see the tannish colonies below the little white hairs in the middle here? So these tannish colonies on the plate, those little tan bumps are ringworm colonies. So we have effectively isolated ringworm in this culture. If we isolate ringworm, it's important to identify it. There are more than 30 species of dermatophytes that affect dogs, cats, and birds. But because M. canis accounts for the vast majority of feline infections, even though the name canis implies dogs, and felines are the most common species we see it in, we will focus on M. canis here because it's the most clinically important in shelters. So what you can see here on the right are spores known as macroconidia. We found these by doing a tape prep from those little bumpy colonies that we isolated on the last culture in the last slide. And notice that they look like boats. So these boats, are definitive for ringworm or dermatophyte infection. Now we know we have ringworm and we need to implement a treatment. So for this, we use a three-pronged approach. And the first prong here that you can see is topical treatment. So here's our little kitty swimming in a soup of lime dip, and you can just about imagine how unhappy that he is here. So for this reason, that's not the way that we recommend lime dipping cats. We have a better, more fear-free way that we can use that you can see in this picture right here. So here you see this kitty, and he is standing in a dry basin. You can see also, I just want to direct your attention that this person, the staff member, is effectively covered in proper protective equipment. This is a gown and some gloves. And then over here on the side, you can see a sprayer. And in that sprayer, we have lime dip. The idea is that we want to, on a dry coat, we want to spray this cat down effectively everywhere so that the lime dip not only gets the hair, but also down to the skin. And if we want to treat a face and around the eyes, we can just dab some lime dip onto a gauze pad or any type of a rag, and we can effectively just treat around the eyes, making sure that we don't get that into the eyes themselves. We also want to use systemic treatment in conjunction with topicals, and ideally we'll use frequent testing to determine when they're cleared. But the things that we have for use are itrafungal or itraconazole, and also oral terbinafine. That brings us to our third prong, which is environmental decontamination. We need to thoroughly clean and disinfect the shelter environment, including cages, bedding, grooming tools, and other surfaces, because fungal spores can persist, and so diligent cleaning is really crucial to prevent reinfection. I want to point out a couple things on this slide here. First of all, we have our rescue disinfectant, which is an accelerated hydrogen peroxide product that's effective at killing fungal spores. And then just as important over here on the right-hand side, you can see that we want to mechanically remove hairs, and we can do that by using a Swifter with the throwaway sheets. So after we remove those hairs with the Swifter sheet, we throw them in the garbage. It's also very important here for laundry. We want to separate our laundry from our ringworm positive animals, and we can use either rescue or bleach in that laundry, or some shelters actually prefer to throw away the laundry if necessary. But the objective is to prevent spread or reinfection. All right, it's important not to panic. Don't overreact. There was a spider, I panicked, but I think it's gone now. So the idea here is that properly trained staff goes a long way. Staff should be trained on recognizing ringworm signs, implementing proper hygiene practices, and using personal protective equipment to reduce the risk of human transmission or animal-to-animal transmission. And remember that these animals are treatable and they're deserving of a chance. So an approved standard operating procedure or SOP can be in place, but it's very important to work closely with veterinarians for an accurate diagnosis, prescription of properly dosed medications, and guidance on the treatment protocols. So regular consultation ensures the best outcomes in managing ringworm in a shelter setting. Always follow protocols. To conclude, by focusing on all of these key aspects we've discussed today, shelters can enhance their ability to diagnose, treat, and prevent the spread of ringworm among animals, creating a healthier environment for animals and for staff. One last pitch. Don't forget the power of fosters. Foster programs save lives. So here's this cute little ringworm kitty. You can train foster parents to dip and treat positive animals, like this cute little guy. You can set up schedules for follow-up testing, and fosters can help decrease staffing needs in the shelter, which is so important, as we all seem to be understaffed with so many life-saving things to do. And foster homes also decrease stress for these animals. Remember that stress, especially for cats, is the #1 cause of co-infections like upper respiratory issues. At Best Friends, we have so many resources and playbooks to share to make your ringworm treatment and foster programs successful. Our playbook is very comprehensive. It includes how-to videos, sample protocols, monitoring sheets, foster volunteer resources, and even disinfectant charts. I want to end by saying thank you for your time, and please don't hesitate to reach out to us if you have any questions or need any help. I've included the Ringworm Management Playbook link down here, And I've also included our shelter medicine email for you if needed. We wish you the best.